Greetings, everyone. Thank you for joining us. My name is Tahsin Rahman. I am a PGY4 at Henry Ford Health in Detroit, Michigan.
And I'm Craig Silverton, the senior author on this paper, also from Henry Ford Health System.
Today, we've been invited to discuss our recently published article from JBJS titled "The Impact of Social Determinants of Health on Outcomes and Complications Following Total Knee Arthroplasty, an Analysis of Neighborhood Deprivation Indices." It shouldn't come as any surprise that in an urban environment such as the one we work in, we treat a wide demographic of patients. And it's very clear that social factors can negatively impact these outcomes following total knee arthroplasty. However, we wanted to have more concrete and numeric data to substantiate this. Therefore, we ran a retrospective study using the Marquee database, looking at 19,000 plus patients, assessing their socioeconomic deprivation using the SVI and ADI, two deprivation indices based off of census tract data. We then took those numeric values and associated them with outcomes following total knee arthroplasty.
And I think when we look at the results of this, it's not surprising. Some of the results showed that the complication rate maybe was not significantly higher, but what was significant was if you had an increase in your ADI or SVI, you had a higher likelihood to return to the ER for a visit, as well as being discharged to a skilled nursing facility. All of those things, of course, raise the cost of healthcare. So as far as what we will do in the future looking at this, I think when we send patients for optimization, one thing we're always looking at is the medical comorbidities, but now maybe we should be taking a stronger look at some of the other indices that may cause an increase in morbidity and mortality, as well as their discharge to a nursing home or to a skilled nursing facility. So we're going to be looking at that in the next phase of our research, and hopefully we'll be able to get back with some further results in the future.
I think ultimately it behooves us as the surgeons not only to, operate on our patients, but advocate for our patients. So figuring out pertinent interventions, I think that's the next step of all of this research, and hopefully it'll be fruitful and beneficial for our patients. But overall, we thank you everyone for joining us and hope that this brings about some change in your own practice.
Thank you.